Hello, good morning, everyone. I'm super happy to see you this morning, Sarah.
Hi, Johanna.
Your talk has been long anticipated. We have so many discussions in our group, in all of the WhatsApp groups, where I think, see, this is where osteopathy could really help, or, give that a shot. So you're always one of the first people I will recommend. So, yeah, super happy that you could join us this morning, and we're hoping for many more moms to join or to watch us at a later stage. Do you want to introduce yourself here or in the process of your slideshow? Either way works well for me.
Probably easier in my slideshow, although I know people like to see sort of faces. So let me do a little bit now, and then I'll just run through it quickly. So my name is Sara Bales, and I work under the company, you can see here, Essence Osteopathy. I've been an osteopath now since 2002. I graduated from the UK, from what is now called University College of Osteopathy in London. I have 2 children myself, although I've had 5 pregnancies, so I'm quite well versed with the different sort of loss stories of that, which I hope just makes me a better practitioner because of personal experience. But yeah, I have 2 grown children. They're off at university now, which gives me lots of time to focus on my patients and the babies. I am originally from South Africa. Everybody asks that because I'm actually a Singapore passport holder now.
Okay.
But I'm originally from South Africa.
Mm-hmm. And what made you go into this field? How did you one day wake up and say, bones, that's what I want to do?
Pretty much, actually. So I have a first degree in economics from the University of Cape Town. And I actually went into that degree a little bit like sideline because I was doing sciences before. And anyway, you're young and you do make strange choices sometimes. Anyway, I was then working in the fashion industry. I was a buyer for a big fashion company in South Africa and came to Singapore working for duty-free shoppers, DFS. That was my original job in Singapore. And I just always wanted to be in this field. I've been seeing osteopaths myself since I was 16, probably.
Yeah.
One day I was in an osteopath getting treated, and I said, I want to do what you're doing. And she was a strong Australian girl. And she said, well, then why don't you? And I was like, oh, I can't, I'm married. And she said, yeah, you can. I did.
Amazing. Great. I love it. And Sarah, you're a bit of I'll let you share your slideshow. And while you do, I'll continue talking. So for those of you watching, Sarah, as she said earlier, has experienced loss herself. So we had invited her last year to speak as part of our loss awareness campaign. And so we find also that osteopathy is actually a brilliant modality for this. And lots of moms have given us the feedback that it's so good to see a craniosacral worker or a craniosacral osteopath for this as well. And yeah, hoping to have you for other, opportunities this October as well.
Yeah, because in that case, I was already an osteopath when I had my losses. And the one in particular, I had help from an osteopath, and it was really significant how much it helped me. So that is something that I'm quite passionate about, helping other mums.
Amazing. Okay, why don't you start sharing? The other reason, of course, why we have Sarah here is that she has a reputation to be a bit of a baby whisperer. So you wouldn't believe how many conditions osteopathy can actually benefit. So we're excited to hear more.
Yeah. So today, obviously, we're going to talk about osteopathy. This is a little bit about my introduction that I just said. I didn't mention that I'm in Orchard Road now. So it's very convenient, 6-minute walk from the Orchard Tube. So customers do find that very convenient. Okay, so I don't know how many people watching will know about osteopathy or have seen an osteopath. And since I can't ask the question directly, I'm just going to go in and explain as if you don't know what osteopathy is or you have not been to see an osteopath. I'll explain what it is and what to expect in your first consultation and subsequent consultations. Now, I am an osteopath who uses a variety of modalities to treat. Because as osteopaths, we have a lot of tools in our toolbox. Like You can do the craniosacral type of osteopathy. You can do more structural type of osteopathy. And there's so many different skills that we learn along the way, which is why I personally always loved osteopathy even before I became an osteopath, because there's so many different ways to approach an issue or problem that somebody can be having. And if something doesn't work, you can switch to something else. And different people, different babies need a more gentle approach, or they need a more structural approach. So it's nice to be able to switch. So the aim of osteopathy is really to improve the health of the body. And as Johanna said earlier, emotionally is part of our health, obviously, and part of what we can do with cranio-osteopathy, definitely. So it tries to improve the health of the body physically and emotionally. And we use the musculoskeletal system, which is our muscles and our bones and our joints and ligaments, and also tapping into the nervous system. It is a manual therapy, which means it's hands-on. We do all of it with, touching the patient. I'll go later into the types of treatments that we use. Osteopathy is suitable for any age. So one of the most common questions is, how young can my baby, when can you see my baby? And there are practitioners who actually work sometimes in birthing centers, and they treat the babies as soon as they are born. And one of my colleagues, Philippe, has treated people up until 99 years old. I've treated, my oldest patient has been 95, or she's 96 by the end. Yeah. So that's another wonderful place that cranial osteopathy can come in, because it is so gentle that it is appropriate for all ages. When you come to see an osteopath, of course, it differs between different practices and different osteopaths. But in my practice, my initial consultation will be 45 minutes. And that's because I like to take a really detailed history. This is especially important, I find, with babies and pregnant moms, or postpartum moms too, because there is a lot in there. And although it might not seem obvious to the mom or on the surface, but sometimes there are very subtle things that have occurred that help me to understand why the person might be suffering from the thing that they are suffering from. So the detailed case history is extremely important to me. We will then give an examination, which is, if it's an adult, asking for them to do movements, us doing passive movements. With babies, it depends on the age of the baby as to how we do that examination. And then in that treatment, you will also, in that consultation, you will also get treatment. I like to be very open with my patients and explain as much as I can, because I feel that when you understand what's going on with your body, you're able to imagine it and deal with it differently, deal with it properly at home, be that with doing your exercises or avoiding certain positions. I think understanding is key to your recovery.
Absolutely, because what I find is often body workers, we go to body workers, and this is kind of a spot treatment in many cases. But if we don't change our lifestyle, the way we sit, the way we move, and so on, and not mindful of the way our bodies move and so on, then we are soon back to the old patterns, So I think it's important that you do that, so that the mom can help the recovery as well.
Yeah. And then later, if she's sort of gotten better from the treatment, and then later she feels the same pain, she goes, oh, I remember that could be this. I can do this exercise, and it can avoid her coming for a second, set of treatments or something.
Yeah,
She can be in charge of her own health.
Mm-hmm.
A large part of our we will also give advice with certain things, especially with babies. A lot of it, I can only do so much in a half-hour treatment, and how we help the mum to help the baby at home, or change certain positionings, or, do certain little exercises with the baby, is key also to getting that baby to be more comfortable in their body ongoing. So yeah, I said my initial consultation is 45 minutes. I then do 30-minute follow-ups. Not always. A lot of patients do request for a 45-minute session as follow-ups, and I will do that, or an hour if they request, or if I deem it necessary. So often with cranial osteopathy, I find it takes a little longer sometimes to settle into the treatment. So a 45 session can be more beneficial.
And I think one important thing to mention as well is that you do home visits.
Yes.
so helpful for our moms who are just postpartum and it's so difficult to get out of the house and they're juggling so many things. And you can benefit both mom and baby in those sessions as well.
You know, home visits are wonderful for the mom, but they're also good for me to see baby in its home situation, because then the advice that you can give is far more tailored and exact to that situation.
Mm.
Yeah, home visits, when mom is, you know, postpartum, breastfeeding, you know, she's got all sorts of things going on with her own body and baby's unsettled, it's very difficult for them to get out of the house. So that is a wonderful service that I do offer.
Yeah, amazing.
Okay, people will also often ask how many treatments I need, what they need. This is absolutely on a case-by-case basis. I don't sell any kind of packages or tell people, you know, how many treatments they need until I've seen them, examined them, and it'll depend on an individual thing. It'll depend on the situation, on their particular case. Often I will then give them an idea. I think it's going to take this many, but we reassess at every visit. So sometimes it's a, you know, one and done. Sometimes I'll say, I think you're going to need 3, let's have a look. But after the second one, they're fine. Or, you know, after the first one, they phone and say, sorry, I'm great. So that is individualized.
Mm-hmm.
I do have a lot of patients who come for maintenance treatments. This also depends on the type of condition that they have, and they'll book in every month, every week. It depends on the person. The pregnant mums will often come throughout their pregnancy. And how often they come depends, again, on what is bothering them particularly.
Mm-hmm.
So what we do in these sessions is really aiming to increase the joint mobility, mainly within the spine and pelvis. But a lot of mums are also experiencing, you know, with the different changes that happen to your body in pregnancy, there's a lot of, you know, whether it's just simply the extra weight that you are carrying, they're going to have often aches and pains, and it even goes up into the shoulders. And so I will treat all the way from the head, the neck, the shoulders, the upper back, but often focusing on pelvic health, getting them ready for delivery.
Yeah, so that's so interesting too, because I think not everybody realizes how interconnected everything is in the body. And
Mhm.
especially in pregnancy, also how everything meets in the pelvis.
Mhm.
You know, the psoas muscle and the back, and, you know, so any imbalances, even though they might come in with a shoulder pain, maybe it's actually their sacrum that needs addressing
Mhm.
and so on. So I'm completely made that up. So,
No,
but
no,
you
no, it's absolutely true, because they're muscles that attach all into this fascia that's at the back, lower back, and there are muscles that go all the way up to the shoulders. And if there's an imbalance somewhere, it's pulling one thing on the other and creating a problem somewhere, which is another reason that I love physical therapy that looks at the whole, because
yeah.
somebody might be coming in with one thing and I'm treating completely somewhere else. And I have had patients say to me, you know, that's not where the problem is. And I'll go, yeah, I know. But this is what's going to relieve your problem in the long term, you know.
Exactly. And then I think another thing that we need to look at is creating that balance also stacks your card in your favor for your birth, because what we often see is that a mother who is well balanced, the baby has more space to move. She also has more mobility, I think, and therefore in the birth process they can work beautifully together, the passage and the passenger, and we see birth going so much easier as well. Whereas when we have these imbalances that are not addressed, we often get these long drawn out labors, long prodromal labors, and so on as well, or even babies that never descend where they need to go. So I think that routine maintenance in pregnancy is a really important thing to do.
It really is. Even just treating the fatigue, you know, mums who have other toddlers at home, or
Yeah.
mums who are working up until the last day, you know, the stress and the fatigue in the body can not be beneficial for the mum. And so by coming for treatment that allows that release and relaxation of mind and body is really helpful.
Yeah. Okay, I'll take this before you move on to the next slide to say, parents on the call, please put any questions that you have in the chat, or even raise your hand if you want, so you can speak to Sara directly as well.
and I do have a sort of frequently asked questions at the end, but usually I find most of them have been answered along the way, even just by me bringing them up. Okay, so this is a slide showing the types of treatment we do. Just for those who have not been to an osteopath before, we will do soft tissue release. It's very much like what people would call massage, but it's much more focused and specific with anatomy knowledge behind and knowing exactly the anatomy chains, where that muscle is going, what it affects. And so it is a form of, we call it soft tissue work, but it's a form of massage essentially, but targeted and specific. We will articulate the joints, make sure that they're all moving correctly. Manipulations, I do not do manipulations on very, very seldom on a pregnant woman, and obviously absolutely not on babies. This is when we do the high velocity thrust, and you'll hear a little click, a little bit like a chiropractic manipulation. But in the case of this group, this is one of the lesser used techniques.
Okay.
Visceral techniques, a little difficult to do on the pregnant ladies. So, that's not something that I'd be doing there, but certainly on the babies with constipation, colic, reflux, and on the mums afterwards or other patients, I will do quite a lot of visceral work. Cranial techniques.
For people who don't understand what visceral means, visceral is working on the organs, like all the organs in your abdominal cavity and so on. Do you want to explain it a little bit further?
Well, so with visceral technique, basically you'll find, and I think actually I have a slide back here. Here you go. So if you see there, I've written there's a visceral treatment. You will see me working a little bit like that on the abdominal region. And there could be different things I'm looking for, different reasons why I'm in that area. But certainly with constipation, for example, that will often be something that we will treat this way. The stomach with reflux, with some people get a lot of burping, that sort of thing. And I also like to just make sure that the diaphragm is working correctly, because that's so important in our whole abdominal cavity. It cuts straight across our whole body and attaches to all sorts of things in the back. That having a healthy diaphragm is super important.
So, and this will also, for all the pregnant ladies, also affect the pelvic floor, because the diaphragm and the pelvic floor act as a canister kind of thing, as one system.
Yeah.
So often, and then another thing with the diaphragm is also moms running out of space for breathing. When in pregnancy, as the baby grows, especially my twin mamas, I feel for you, you've got two of them in there. It's often quite difficult to find that space. So I like to give them specific exercises, but a release that you can do in that area will also be really helpful.
And so this is something we can also do with cranial osteopathy. And then structurally, I might work on the upper ribs to give all of that thorax better mobility. Cranial techniques is something that you see in the picture here. It's a very gentle, completely non-invasive treatment that, people say, what does it feel like sometimes? And it goes from basically you feel, the patient may feel very little, but they feel a great calming or sense of release, but it's more in a gentle way. It's not something like you massage a tissue and you're actually feeling it happen. It's very, very gentle. And then, of course, we'll also give advice, like I mentioned before. So getting more specifically to pregnancy and postpartum, I've mentioned already that these are some of the things that we treat. Upper back and shoulders. I like to make sure that the upper back and shoulders of a pregnant mom are in the best state possible, because once her baby's born, she's going to be using that part of her body a lot. She's carrying, she's lifting, she's breastfeeding, positioning of breastfeeding is often not good, especially for first-time moms who are a little bit nervous about holding their baby and so on. So if we start with a newborn and the breastfeeding journey with a very healthy upper back and shoulders, head and neck, in fact, because it all connects, she's going to have an easier journey. Also something, of course, that I look at in the postpartum mums because of the same reason. The rib cage, like I mentioned, we need to get all of that moving and working like you just said, Johanna. The sacrum, pelvic, pubic symphysis are obvious ones. Lower back pain and sciatica can be quite common in pregnancy, so that will often be addressed. Water retention, again, quite common in pregnancy, something we will address. Plantar fasciitis, also, but often that requires sort of maintenance through pregnancy and some help after pregnancy. And of course, like I mentioned before, to promote the relaxation, super helpful. In babies, this is not an exhaustive list. There is so much, it's impossible to put it on one slide, but most commonly, mom will come to us with a fussy baby, colicky, possible reflux. They may or may not already be on some kind of probiotic or reflux meds, and digestive issues. Babies who are not quite pooping as they should. We will deal with that. Plagiocephaly, this is what's more commonly known as flat head syndrome, or any anomalies with the head shape. So this is something, this torticollis and latching issues and tongue ties and are something that we treat very, very often. With the flat head, babies' skulls, it's a whole nother talk that I do, but babies' skulls are made to, the bones are made to overlap during the birthing process. And after that, they, through the sucking and birth, they will realign themselves. If they don't, there's often a tight muscle or some tension pattern in the body that's pulling it in a certain way, and we can address that to help as the baby grows, open up the mechanisms that allow the head to form without the flatness. Also, some of that might be positioning, so the mum might need help and advice with that.
Is there a difference between babies that are born via C-section versus a vaginal delivery?
You know, this is an interesting one because I myself had 3 C-sections, and well, the one is not irrelevant, but I had 2 babies born by C-section and they had perfectly shaped heads. And I've had babies come in from C-sections that have the flat head. So I personally have not seen a correlation there, but when I was a trainee osteopath and I had my first baby during my osteopathy course, and I was intent, you have to have a vaginal delivery because of the lapping over of the bones and the opening up. You know what? Ideally, that's what we know should happen, but the C-section babies can be perfect, can have a flat head.
Yeah.
So I'm worried
also,
about that.
you know, babies that might be stuck one way during the whole pregnancy, that don't move much side to side, that sort of run out of space in one area. I had a baby like that who actually had her foot almost glued to her shin because she was stuck in the utero like that and couldn't move that leg. So
this is what we believe is more likely to be a reason for it, but I don't like to say specifically because it causes concern, and there's no real definitive explanation, but it's just something that we need to find it, fix it, leave it alone.
Yeah. And then coming back to the flat head, is there a special, like, is there any advice what people can do to avoid it? I mean, I know that osteopaths are not big proponents of pillows, yet many cultures propose that as a way to avoid the flat head. What is your take on pillows and other advice to avoid it?
Well, because of SIDS especially, we say the baby should be in a crib with nothing.
Yeah.
Babies have started to, since the back to sleep program to avoid SIDS, we've been laying babies on their back. So because we need to have them sleeping that way, when they're awake, during their awake times, we like to say, have them upright, have them on tummy time. Doing tummy time is one of the best things to avoid the flat head. Positioning or positional plagiocephaly can be avoided by making sure that your baby is not sleeping in one position all the time. We also say don't keep them in hard-backed carriers, like a car seat, for example. Baby should not be sleeping in the car seat. Because head shape and positional plagiocephaly certainly could be one reason, but the other reason is we don't want them sleeping in too flexed a position because of the breathing mechanism there. And feeding baby in different positions. Sometimes the babies that have flathead starting will have a tightness, the torticollis, the next point down there. They will be favoring one side. They will have a tightness. And because of that, they always tend to be lying on the one side. So positioning baby differently. You can top to tail them in their cot. You know,
Yeah.
you can keep one day one face with the head one side and the next day the other side, or one nap, the next nap, however it works for you. Or in fact, sometimes what you can do, depending on the setup you have at home, is move your entire crib.
Okay.
So to avoid the flathead syndrome, positioning and mixing that up, tummy time would be the main things to start at the beginning.
And when would you start that and how?
So you can start tummy time from birth, because even contact napping, when you have your baby on your chest, is considered tummy time. So when you have baby chest to chest, if they straight up, it's still tummy time in a way, and you can decrease the angle. And by that, your baby's getting more and more tummy time. So it can start right from the beginning. Of course, we're not putting babies on their tummies and forcing them to be like that, like it's some kind of, boot camp.
Yeah.
But they can start right from the beginning and then slowly increase their time as they grow.
Okay. And I recently had a client who's, I think she's now 2 weeks postpartum, so not very long, or maximum 3. She's telling me that her baby is almost turning in the cot. And I think I heard somewhere that this is a sign that maybe there's tightness on one side as well. Is that true?
Yeah, it could be, because sometimes, babies have been scrunched up in the womb in a sort of certain way. And sometimes that pattern just doesn't automatically sort itself out, which of course with babies, it will usually, with them lying, moving as they come out of utero. If the baby's being swaddled too much for too long, then this can lead to the baby not working out that strain pattern possibly. But certainly having a consultation with an osteopath, or I don't like to always say osteopath, like any physical modality of treatment that deals with babies, can assess that and help you with certain stretches that can work out that strain pattern.
Amazing. And we've got a question in the chat. Thank you so much for asking this question. May I ask if a pillow for flathead works? You know, the one with the donut kind of pillow with the hole in the middle.
This is a very difficult one for me, because it depends on, we are supposed to say no pillows.
Okay.
But there have been occasions where, with the type of flathead that baby's had, it has been beneficial. But in general, we say no.
Okay, interesting. So it would require an assessment to see if that is a good strategy for that baby.
Yeah.
Okay, amazing. Great.
Okay.
What else do we have with babies? Milestones. That's a really good one too.
Yeah, so some parents will come when the baby's a little bit older and be a bit concerned that the baby hasn't reached certain, well, often they will come before the milestone, it's getting close to the milestone and they haven't quite, missed it exactly. And then we can help with things like that too. There might be a tightness in the sacroiliac joint, or, they just might be not doing enough tummy time, not having enough strength through their upper body. And there's so many different things. And we can just help the mum with that, give a few little tips, and baby will very often reach that milestone very soon afterwards. I mean, there could be things like baby's been spending too much time in containers of some sort, and so they're not developing their core strength, and so therefore they're not rolling. So
Yeah.
they just might be sort of quite simple things that we can help mum with. Latching issues is another big one that we deal with. When I'm not a lactation consultant, and I will work closely with lactation consultants, but it is the physical side of things as to why baby might have tightness in their jaw, in their neck, the back of the head, or in the tongue itself or the muscles that move the tongue. And so we can work with that. And assessing baby for oral ties is something that we do as well, and then seek advice and we'll refer them on to get that dealt with if we feel it's necessary.
Amazing. 2 more questions in the chat. I don't know if you're familiar with that pillow, because I'm not. She sees a lot of parents recommending the Rototo Bebe pillow to prevent reflux and help with colic issues. Rototo Bebe. I've never heard that before.
I will look that up and get back to you on that.
Yeah, that would be interesting, because I think reflux is something that is so, I think in a way it's over diagnosed as well. Like there's reflux that is your bog standard, run with the mill, spit up, that is quite normal and not concerning. And there's real acid reflux that is quite debilitating and so on. But I think it's such a complex issue that a lot of moms are sort of walked into needing to take the proton pump inhibitors like omeprazole and so on, when we know that, I mean, I have read studies that basically say that it's a little bit 50-50. It's luck of the draw, whether that will work for your baby or it doesn't. So that's definitely a tricky one. So it's good to see that as a first resort, we could try and see if osteopathy helps with that rather than giving the heavy duty drugs.
Yeah, and I've found even the pediatricians will, often it won't be their first thing to prescribe with omeprazole, but then sometimes it's tried for a bit and then it doesn't work, and then we realize it's not that. But seeing an osteopath, or as I say, any physical therapist who works with babies, definitely a good idea to see if that helps before we go. Yeah.
Amazing. To the mom who asked the questions about the Rototo, Sarah, will you look that up later and maybe give your advice on it or what you think of it? And then if Mom Cindy, if you want to contact me, I will forward that to you. I'll also make a note to contact you, Rototo. Okay, next, are you happy to move on to the next question? Because it's also a baby question.
Oh, yes, sure.
So my baby is 11 months old and started banging his head when he's frustrated, which is quite scary. He seems to be sensitive and have a very active nervous system. Also, he never slept through the night. Is there any treatments recommended in such a case?
This is a beautiful case for cranial osteopathy.
Mm-hmm.
Yeah. Where we can help to calm his nervous system, hopefully, and help him feel more comfortable in his body.
Yeah. So this is so
7 months old. Okay.
This is so fascinating for me to see as well, is what you're able to feel just by touching that baby and seeing where the imbalances lie and releasing some of the, not only tension, but just making the whole nervous system work more efficiently, I guess. And I have had reports from quite a few moms, not only regarding sleep, but also, yeah, just fussy, unsettled babies that had a massive improvement just with a session or two. So that's really fascinating to see.
Yeah, this is a typical case that we would see for, like, there's no reason for it exactly. And then, I'll feel the baby and do some cranial osteopathy, and very often the baby will be like calm and sleeping for a lot, especially that day, just really resetting themselves.
Yeah, amazing. Next question is, can osteopathy help provide instant relief to hip soreness during pregnancy? This mom has tried physiotherapy, but it always includes some exercises to do at home before seeing results. While I'd prefer to have some relief instantly. That's always the toss-up, isn't it?
It's, again, depends what's causing it. Instantly, often patients will get instant relief, but then it comes back because of maybe what's causing it, or because you still have to walk, you still have to move around. Is there anything in there? Was there a past problem? Is there a labral tear? Was it the mum very sporty before? Could there be something underlying? So it depends, but instant and absolute relief, I wouldn't like to say anything before I see the patient, or whether it's going to be a management issue, or I don't think that's something that we can, like, there's some things that we can say for sure, like a rib lesion, you can click it, instant relief. With something like a hip in pregnancy, would probably take 3 treatments. When I say, like, I sometimes judge, not having seen the patient, I would probably say 3 treatments to see where that's going, depending on.
Yeah, because the hip is quite a complex structure that is so important in pregnancy, and where there's so much changing in pregnancy as well.
And it's changing every week. It's only getting, you're only getting heavier, and your posture is changing, and it would depend sort of really where and why and how long it's happened, and did it happen before pregnancy? So there'd be a lot of questions that I'd be asking around that.
Amazing. Okay, that's the questions for now, but moms, please keep them coming. We love responding to your questions directly.
So another thing that about why I love osteopathy is this specific and individualized care for each patient. There's no patient that comes in that I can say, I've seen this exact thing before and I've treated it exactly the same way. Obviously it does happen, but it's seldom, because every body is individual. Every person has their own history of accidents, aches and pains, and what they've been through in their growth. But also, we in our practice have the ability to see the whole family sometimes. It's difficult in Singapore, but it has happened to me where I've seen the grandchild, the mom, the grandmother, and the great-grandmother.
Wow.
But the fact that we can treat both the mom and the baby, and we treat mom through pregnancy, and then we have the baby, this continuation of care is something that's really special in our practice. The continuous care, follow-up post-pregnancy. And it's important to let patients know that confidentiality is paramount for us. So we all as osteopaths take that very seriously, and it's lovely to have the safe space when they come to see me, because we see patients for longer than just 10 minutes. I'm seeing them for 30 minutes or 45 minutes. So whatever comes, this treatment room is a safe space, and whatever comes out stays here. And so sometimes mums will, have lots that comes out, and they feel much better just for that.
Yeah. I think that's so helpful, because as you say, we go to our GP and our OB-GYNs and the pediatrician, and it's always very rushed. So to just have that moment to sit and someone to listen to you is really important. And often by talking to someone, we unpack stuff that we didn't even know was related to what we're experiencing as well. So yeah, quite nice.
This is just a little extra slide in case anybody wanted to sort of see what we do. And questions, I think we've probably covered most of them that I sort of put commonly asked questions. The age that an infant can start having osteopathic treatment. The question I often get is, what is the difference between osteopathy, physiotherapy, and chiropractic? And the answer to that basically is there's a lot of overlap.
Yeah.
So if you have, in this case particularly, somebody who's experienced in treating infants and pregnancy, finding the therapist that works for you is important. And the type of tools that they learn, there's such an overlap with how we all learn. It's just mostly the philosophy behind it that is different. But any practitioner can start treating in the way that suits them. And so you'll find an overlap.
Yeah,
and then
but there's also a difference, right, Sarah, between different schools of osteopathy, or just different types of trainings that moms have, because practitioners have, because no two osteopaths work the same way, correct?
Well, the thing is that, there's we're all trained in pretty much the same way with the same philosophy. But then we're all individuals and have different personal interests, different skills, or where we prefer, what place we prefer to work in. So I, for example, am never going to be that osteopath that's going to have a gym in my practice and be giving people like, you know, big exercise types of treatment. Like that's not where my interest lies. Not that I sort of, if I'd started from the beginning 20 years ago going down that route, yeah. But so people tend to sort of go where their interest is. And mine has just really always been focused in the cranial field. That's not that I don't do structural, I do a lot of structural work as well, but it's not, I'm never going to be working with elite athletes, for example. That's, I would send you to somebody else. You know, when people do come with things like that, I often will refer them to somebody who does that better than I do.
Yeah, amazing. I've got another question in the chat. I've been experiencing middle back pain for 2 months, probably because of breastfeeding or holding my 11-month-old who's getting bigger and bigger. I've never had this before. I've been doing a lot of yoga, massage, and I went to a chiro, but it didn't help. Do you have any recommendations here?
Yeah, come and see me. I mean, yeah, it's a very, very common thing that we see. And sometimes it just needs a different view. You know, even within osteopaths, you can see one who treats it in a certain way, and you see somebody else, they just see something slightly different, treat it a certain way, and it helps you out. So without knowing, without seeing you particularly and knowing exactly what it is, I can't give advice exactly, but definitely this is something that should be able to be sorted out.
Yeah, great. Okay, the next question was, is osteopathy safe after C-section?
So we always like patients to be cleared by their doctor, but depending on the type of techniques you use, then yes, it is. If we're using the craniosacral type of osteopathy, yes, I would stay away from the scar for 6 weeks. But then depending on fascial adhesions and so on, some type of work on the scar after they've been cleared by their doctor is helpful. So is it safe after a C-section? Yes. When? 6 weeks for sure. Before that will depend on the type of treatment that we use.
Okay. I was also going to ask you, postpartum, what are the issues that you commonly see? And I refer now specifically to birth and a lot of moms who are asked to be pushing, lying on their backs, or moms with an epidural who are just lying in labor for a very long time and don't get that possibility or that ability to move. I've seen, you know, tailbone injuries, and obviously you look at the sacral, the sacrum is what I wanted to say as well. What are the issues that you typically see and treat postpartum that relate to the birth?
The birth itself. So coccydynia, like you mentioned, tailbone pain is quite a common one because obviously during birth there is movement there. There can be quite serious problems with the coccyx. Very rare, but it does happen. But just some sort of coccyx pain after birth is something that we will treat. Sacroiliac joint pain, even sciatica that comes because of the positioning, the legs up, something has gotten pinched during that process. So that might be something that we will see and treat. I do not do internal exams. I do not do internal treatment.
That's good to know.
So for that, I would send them to somebody who's more expert in that. You know, we're trained in it. I've done it, but I haven't practiced it for 20 years, you know, like consistently. So I'm very open to say, I know what I can do, and I know where somebody's better than me. And my job, I feel, is to treat the person in front of me with whatever means available to me. And if that means referring them to somebody where they're going to get a better outcome, that's what I will do.
Yeah, amazing. And that's great, you know, to just, we all have our specialities, I would say, and another person might not be as good as you are at, doing stuff with babies and working on the very gentle stuff and nervous system and so on. I think we all specialize in an area, and then it's we stick to our guns, and rather than prescribing 10 treatments that don't work, rather be honest and open with the client.
I'm never going to be the best person for internals because I don't do them every day. So why wouldn't I send you to somebody who is?
Mm-hmm. And then I think we've we've already talked about how many sessions and how that really depends on what is presenting.
Yeah. Sometimes a mum will come to me with a baby and it really is just a one session because she just needs some reassurance, some advice, few little tips, and it's great. And that's fine. Sometimes the baby can have quite a complex presentation, and I might be treating them weekly for quite a while.
Yeah, always depends. And we're such complex creatures as well, I think, that working on what is happening in your daily life and making some changes to your lifestyle, your posture, the way you move and so on is also crucial, I think, to give that additional support to the spot treatment.
I mean, like your mum with that wrote the question about her mid back or mid to upper back pain that she has. I don't know what exercises she's been given or what her sort of breastfeeding setup is, or there might be sort of specific things that she needs to be looking at to do that could save her lots of treatments if she does it, just changing a couple of things.
Yeah, amazing. Okay, parents on the chat, my chat is not working. Sorry, on the call, my chat is not working. I cannot move it. I cannot close it. I cannot reopen. I can't do anything. So if you have any questions, can you please maybe speak up or raise your hand while we still have Sara on the call? I just thought of a different epidurals. So not all of my moms, but a lot of our moms these days do end up with an epidural, either because they're planning it for pain relief, which is one of the best options when we're going through this intense moment, and others just end up with it because it's been such a long process and they need a sleep and so on. But epidurals, we know, have a lot of side effects as well, and I have had a few instances where the moms have had persistent rather, back pain for months, and also postural headaches. So I see that. Have you ever treated, or are you familiar with that too? Is where you just get the headache when you stand up rather than when you're lying down?
Yes, and this is something I do see a lot. Some sort of backache, back pain after epidural, or this headaches. Now, what we treat in craniosacral osteopathy is this system inside where this dura that is punctured during the epidural is affected. So again, here, craniosacral therapy can be very helpful for this type of headaches.
Okay, that's amazing. That was an unknown side effect to me. I mean, obviously it's on the form and stuff like that, but I had never seen it so acutely, but it typically goes away anyway, but it's good to get some help for that as well.
This is something that, patients could come in like saying they're complaining of the headache, and then we just look further and further as to what could be, causing this. And then I could be treating further down, around that area of the pelvis. And more often than not, we can sort it out in a couple of treatments.
And then I've seen quite a few moms as well who are wondering, about my baby. They sort of look like their feet are turned in slightly. They are, they just always have their knees bent. Is that normal, or should they be lying flat? Like, what is normal in a newborn, and what to expect there as well? Ooh, I just got a message through. So anyway, but I'll let you answer that one first.
So, I would be more concerned if the baby was lying with very straight legs from the very beginning. You know, it is normal for them to keep this fetal position for a while. And that's why tight swaddling of the legs is not a good idea, because we want them to be moving them around and using their muscles. And usually those patterns will work themselves through. Sometimes the baby does need a little bit of physiotherapy or osteopathy to deal with the talipes that turned in ankle. As you said, like your baby was with the foot right up against the shin for quite some time. So then it possibly took a while, or even did you get physical therapy for?
So we were told to massage to begin with, and that sort of sorted it out. She was definitely able to move that foot and obviously walk and all of that. But you know what? I do think that this had a ripple effect too onto her knees and her hips. And she's got hip dysplasia too. So I don't know what caused what, because she might have had that from birth and it wasn't addressed. It's a chicken and egg kind of situation, I guess.
But it is something that parents can get quite concerned about. And if it's still, they're, past sort of 3, 4, 5 months, when baby has really had a lot of time, then it is a good idea. But sometimes in hospitals, they will be sent to a physio to work with that if the doctor thinks it's quite severe.
Yeah, I mean, that was 30 years ago, so things have changed. What is the best position to sit while you're breastfeeding so we can prevent back and neck pain?
Comfortably, essentially. Okay. So, women have very different positions that they prefer to feed the baby in, but to be supported and to not be holding
yeah.
baby. This is what I find is the most problematic, is when there's too much actual physical holding. Mum should be sitting in a way that she's not having to use her upper back and arms to be lifting and holding. The other thing is to, this phone neck that people talk about. Mums will often get this phone neck from I love my baby too much neck. They're looking down at baby a lot. And that can create a bit of a problem. So to remember to relax and let your neck be, not all, of course, you're going to look at your little baby because they're so cute, but to sometimes be looking up and making sure that your neck is mobile and not stuck and downward looking.
I'll add to that as well is, yes, we are hunched over, but that is just something we need to do. We need to feed our baby, right? But just to be a little bit mindful and incorporate some exercises into and stretches, just simple stretches into your daily life. When you get up from breastfeeding, do a bit of a shoulder stretch, your arms interlinked behind your back and so on, and stretching it out that way. Or I always say, when you walk through a door, have your hands on the door frame and let yourself lean into that stretch a little bit as well. So there are certain things, and I'm guessing this is what you do as well, to give them some.
So it's the sort of opposite of what you've been doing. So some mums prefer to feed lying down, but then, it's also, there's certain things that we need to look at there. Is she comfortable? Is the head supported, or is she, having her head up, etc. But certainly the most, common sort of way of holding your baby in front, you're going to be pulling these muscles forward. So it's about doing the opposite of that. Stretching out your pecs, as you say, interlinking, stretching them out that way, but also having strength and mobility through the rhomboids at the back. So we might give them exercises to do for strengthen the back muscles as well.
And a lot of gynaes say, oh, you can't do any exercise until, you're 6 weeks, 8 weeks postpartum. But these kinds of exercises, they don't affect your recovery of your pelvic floor or anything like that. So they're quite safe to do. So I give my moms, actually, all my doula clients get exercises to do from the day the baby is born.
And even neck stretches to either side, shoulder mobility, this sort of thing is absolutely fine. And even, for the mums who have given birth with the pelvic floor or C-section, just simply, with your legs straight, pushing your feet down and up and down and up, to get that fluid moving and things like that I will give them, which is not going to affect their recovery.
Yeah, exactly. So they're quite safe to do. Is there any pregnancy pillow you specifically recommend to avoid backache for postpartum due to sleeping position during pregnancy, specifically in the last months?
Not specifically. I find that I have not gone into that speciality. Parents have normally already got all their set up themselves. Yeah. But
Okay, but it's generally advised to have something between your legs when you've got issues with your sacroiliac, maybe to keep that pelvis stable.
also a wedge-shaped pillow or something under the tummy a little bit. So yes, to have that support, but any specific one, I've seen all sorts of mums using all sorts of different ones. And as long as you are using something, you know, that making you comfortable, lifting your belly slightly, especially in the later stages, having your legs apart, as you say, so that your sacroiliac joint is not getting too gapped or squashed. Yes.
This might also be a question that you could ask in the pregnancy group, in the WhatsApp group. What I find too is often the material also is so important because it's so hot here in Singapore. So sometimes what works really well in Europe in the winter is a nightmare in Singapore temperatures as well, because it's not as breathable potentially. So maybe other mummies have good recommendations for you there as well. Where was my other question? I was going to ask you something that I've now forgotten. Baby carriers. Any thoughts of those on those, because they obviously affect the way the mom carries, the way the mom holds herself. So I'd be interested in seeing whether you have any advice on structured versus sling and things like that, soft versus non, or just any advice on what to be mindful of when we carry our baby in the carrier.
Well, this one, you know, we need to be mindful of the baby's leg position and have checked for hip dysplasia before. So that is something. The soft carriers, I think, are great at the beginning, but then later they don't give as much support for the baby. So, you know, there's also a stage and time for that. But if they're too hard on the legs at the bottom, that can be a problem. But I think making sure that you've got the right position of the legs is the most important thing when they're a little bit older and you're carrying them. But baby carrying is very, babies love it, and it keeps them calm and it keeps them close to mom, which I find important.
Yeah, absolutely. But in from the mom's perspective and how it affects her body.
Well, support on the back straps, you know, having comfortable padded straps, you know, the soft ones, whether it's one side, then I would suggest to change the sides around, both for position of baby and for the comfort of mum, but having good supportive shoulder straps and support at the back so that mum is not carrying it all forward, that she's got that support in her system. And also here, the other thing is, you know, our pelvic floor and core strength is not great straight after pregnancy. So doing some work to get that strong so that when you're carrying, you actually have that support of your core is important too.
Yeah, amazing. And then I see, and this is more dads, interestingly, than moms, who carry their baby facing outwards a little bit too early. What is your recommendation on that? When can we have them facing out?
Well, baby needs to have good neck support before they're starting to face out. So yeah, don't face them out too early.
But it affects the hips as well, right? Because the ones that are, when we have them facing out, the legs tend to be straight rather than in the W shape or M shape.
Yeah, so they shouldn't be facing out before they're a bit more mature. And that's why I like those soft ones at the beginning, because baby is still, you know, so all in their little fetal position type of thing, and they're totally comfortable there. So yeah, don't put them in the hard carriers or the front forward facing forward carriers too soon.
When they're not ready. Okay, amazing. 2 more minutes. If anybody has a question, I'm happy to ask it. Otherwise, let's repeat that you are at Essence Osteopathy at Forum Mall, so very convenient location for any mummies because it's so close to an MRT and all the buses as well and so on. And they can reach you. I'll put your contacts under the YouTube video as well to get in touch with you. Perfect. That's here as well. If you can send me this, yeah. Anyway,
I can send you this in a WhatsApp. Yeah.
That's really great. So thank you, Sarah. It was really educational. We learned a lot. Mummies, lots of mummies saying thank you in the chat as well. So it was so good to have you on the call. We learned a lot. You can stop sharing now as well. And thank you all the parents who joined us this morning too. It's always so good to have many on the call, and I know it's long and not everybody can stay on for the whole duration, but it's really great to see you and have your questions answered. So thank you again.
Thank you.
I'll post this on YouTube later and then send you the link so you can share it with your audience as well.